All right, well, good afternoon. We'll get our September the 29th briefing started. We'll get it open for you, and then Judge Canales will be here, and then Annette Rodriguez will come and give us the statistics for the day, and then Dr. Bird is here to educate us about COVID and where we are, and I understand that these meetings now will just be on Tuesdays in the future, so that's a good sign. That means we're making progress, but we do want to keep you informed. But if anything significant changes, well, we can certainly come back at any time. But we feel very good about the path we're on, and we just got to stay the course. And to do that, we've been asking everyone to abide by the protocol of the rules and regulations of personal hygiene and masks and that sort of thing. And we also, if you'll recall, we initiated an appreciation tour of our local restaurants that have paid attention and been in compliance with the rules in terms of the table seating and the capacities. So I want to quickly, this is the second list of restaurants that have been in 100% compliance when the health department inspectors have gone out there. And we're trying to help our small businesses and give you confidence to go back out to the restaurants because they've endured significantly during this COVID. So let me just share with you quickly the names of the restaurants, and some of them we'll throw in an address because there's several restaurants with the same name spread out through the town. So if I start giving out addresses, then the restaurant name probably you know on its own, but on several there may be like a Whataburger. You want to know which one it was. So we'll get to those. But Acapulco's Mexican restaurant on McArdle, Agave Jalisco Mexican restaurant on Baldwin, Atomic Omelet and Grill out on South Staples, 6646 South Staples, Boathouse Bar and Grill out on Leeward on the island, Brooklyn Pie out on Padre Island Drive out on the island, Bubba's number 33, you probably know where that is, Cal Allen Starbucks, Cancun Mexican restaurants, Church's Fried Chicken at 4901 Greenwood, Coral Bean Cafe at 7426 South Staples, Dairy Queen, number 20 at 5002 Greenwood, Doc Seafood, everyone knows where Doc Seafood is, Domino's Pizza at 2501 Highway 361 in Port Aransas, Domino's Pizza at 3719 Leopard in Corpus Christi, Dunkin' Donuts, Subway, number 6871 at 5017 Saratoga, Good and Crisp Chicken, 14601 South Padre Island Drive, Hawaii Poke on Saratoga, Howard's Barbecue, Jersey Mike's Subs, La Ribia, 1602 Morgan, Lupia House, number 2 at 7426 South Staples, Marble Slab Creamery, 5521 Saratoga, McDonald's, 4031 Saratoga, Mikoto Raymond, 6133 Saratoga, Miller's Barbecue, 1035 Leopard Street, Morgan Street Seafood, Nolan's at 7426 South Staples, Olive Garden, 5258 PID, Panda Express, 4119 South Staples, Panjo's Pizza. It's been here a long time. You know, Judge, you know where Panjo's Pizza is. 1320 Airline, Papa Chulo's Mexican Restaurant, 4861 South Saratoga, Pizza Hut, 4001 Saratoga, Popeyes, 6829 Padre Island Drive, Popeyes number 262 at 5009 Greenwood, Rock's Discount Vitamins and More at 6903 Saratoga, Rockstar Sushi Hibachi, 4102 I-869, Sandy's Diner at 704 Ayers, Smoothie King, 5017 Saratoga Boulevard, Snowball, 3830 Baldwin, Stripes on 3501 Highway 361 in Port Aransas, the Subway, 1202 North Chaparral, Subway at 5441 Everhart, Sugar Bakers at 2766 Santa Fe, and Taco Bell at 1501 Nile. Tuckwan Asian Fusion Bistro, I hope I pronounced that correctly, 5216 South Padre Island Drive. Taylor Center Deli, 3636 South Alameda. Texas Roadhouse, Wendy's, and Whataburger at 6817 South Padre Island Drive. I know you probably say, why did you take time to read all that? Well, these folks have really taken it on the chin during this COVID, and if we can do anything to help get traffic back into their facilities and recognize their efforts to be in compliance with our inspections, we feel like that it's worth our time to acknowledge them and say thank you to them publicly, and we will be providing each one of them a appreciation certificate from myself and being compliant with the regulations. And it was kind of fun. I went in a restaurant the other day and they had theirs right there on the counter so the public could see it, and they take great pride in that being recognized. So we hope this helps and drives some business back to them and gives the public confidence that many of our restaurants, most of them I would be willing to say, are trying their best to be in compliance and keep everyone safe. So we thank you very much for that. At this time, I'd like to call on Judge Canales to come and make her comments, and then following her, Annette will come and give the current daily statistics.
El día de hoy tendremos a la juez Bárbara Canales, a la directora del Departamento de Salud Pública, Annette Rodríguez, y al doctor Chris Bird con su presentación. Como recordarán, llevamos a cabo visitas a los restaurantes que están cumpliendo con las órdenes. El alcalde dio la lista de esos restaurantes. Cada restaurante va a recibir un certificado de agradecimiento y reconocimiento por su responsabilidad. Le queremos recordar que estas conferencias solamente se van a llevar a cabo los días martes, a menos de que tengamos otra información importante o las cifras cambien de manera negativa. Ahora la juez Bárbara Canales nos va a dar su presentación.
Thank you so much, Barbara Canales, Nueces County Judge. Well, today I'm very proud. I'm proud to join the mayor and city manager, although he's not here. I know he's watching somewhere. And most importantly, our health department director and our partners today from Texas A&M Corpus Christi. And I'm here at least to share some great news. I'm going to watch with anticipation their projections, and I actually already have heads up on our numbers today. And although I don't really love the numbers today, let me just say that I want to report on where we have been the last 7 days. You should never make any decision based on one 24-hour period. And so here is the good news, is that we have gone from worst to first. We went from having the highest rate of COVID infections in the state of Texas. In fact, at one point, sadly, we were one of the highest in the nation. And so now we have been the last 7 days the lowest. And we've come such a long way from where we were in July. This is something to be proud of, and it's something to be very grateful for. And I also think we must carefully and vigorously defend this line that we have now drawn for ourselves. And so you're going to hear all of us collectively repeat what everyone from the governor on down to county judges and everybody in between has said time and time again. All of those important mechanisms of washing your hands, don't touch your face, wear a mask, maintain social distancing, and avoid crowded places. So look, now is the time that it's more important than ever to be extra cautious if you're in a high-risk group or if you live with someone who has an elevated risk. The elderly, the immune-compromised, people with respiratory illnesses like COPD and asthma, these people are all at greater risk, and those who are obese or have diabetes. We know that even though these numbers have put us in first, we still have active cases in our community, and in fact, there's 471. So that list I just read of those highly vulnerable people, you still need to be extra vigilant. For some, we've already talked about it, COVID can just be like a mild cold, and for others, it's such a severe illness. For some, it's deadly. And in fact, although it gives me pleasure to tell you we're first, it gives me no pleasure to tell you that our numbers at 400 and I think it was 17 yesterday are really actually quite brutal for our community. And we want to ensure that our most vulnerable stay as safe as possible until we get a vaccine with mass distribution and mass effectiveness. And sometimes all these statistics, they're so hard to get your head around sometimes. And sometimes being in that high-risk group means just that you are more likely to get ill. But you need to remember that if you're in a lower risk, that you also do not take chances, and it certainly does not mean that you are immune to coronavirus. And so all that we have discussed just means that with the extra cautious, and if we maintain our prevention efforts, we're going to keep holding the line in this first place category. And so I want you to know that I started to receive some information that I wanted to clarify yesterday, because when you start broadcasting this good news, we started getting questions about when we could stop wearing masks. And we started hearing about other counties like San Patricio who are potentially ending their mask mandate. And people said, well, what about us? And so I just wanted to remind everybody, because I think it's a good clarification, what the current statewide orders say from Governor Abbott and how they work. So, okay, we are operating under the GA 29. That was issued in July 2nd, 2020. And so it's very important to understand that it applies to all Texas counties, and here's a but. But counties with 20 or fewer active cases can be exempted if they opt out, and that is the situation in San Patricio. So there's a process, and those county judges have to submit an application to be exempted to TDEM, and that's the Texas Division of Emergency Management, and they list the counties on their website that have opted out. So you know, if you go into those counties, that there's not a mask order in place. And of course, again, the factors are fewer than 20 active cases, and the county judge requests the exemption. So, as I said just a moment ago, we are currently showing 471 active cases, and Annette, I did this before the numbers today. We are a long way from 20. Let me say that again. As good as we're doing, we are a long way from 20. But new cases are slowing, it appears. And as we recover and our recovery continues, it's always possible, always a potential that we could be at a point where we would qualify for this requesting of a mask ban. Of course, if you believe the science like I do, some scientists believe that this is as good as a vaccine. And one must ask themselves, why are we doing so good when all our neighbors around us, Hidalgo, Cameron, Victoria, and Webb, are still really struggling? We must be doing something right. And so I want to take time away from my notes to again applaud our entire coastal Bend region, but particularly Nueces County, for doing it right and wearing their masks and helping us really knock down the spread of this virus. And so I've always said that decisions should be guided by data and science. And of course, I'm going to keep on with this train of thought because it's working here in Nueces County. And that's very important, I think, that we're doing our part so that possibly we can get there. How great would that be to have fewer than 20 cases, Director Rodriguez, like our neighbor in San Pat? And so as we are thanking people, let me highlight the contribution of Dr. Bird, Dr. Tissot, and the entire Texas A&M Corpus Christi team. From the start of 2020 and even before the coronavirus was declared a pandemic, Texas A&M Corpus Christi has been and will always remain an essential partner in our efforts to combat the spread of COVID-19 in Nueces County. And when I say my decisions will be informed by science and driven by data, I have to say, Dr. Bird, that you and your team are the ones that I've turned to time and time again. From health sciences to data and modeling to unmanned air systems and beyond, Tamuk has been an outstanding partner for the county, and I'm certain for the city too, in our effort to understand and fight this disease and to understand how it specifically impacts people who live here, people who come and visit us, and overall our region, since we are a healthcare center for over 14 counties. And so I was asked recently, I don't even know if you guys know this, I was asked recently to provide a quote in your Coastlines magazine. And I'd like to tell you what I decided to place at the bottom of my personal comments. And this I stole from Dr. Oz Blow, CEO of Christus Spawn. He likes to quote Henry Ford, who said, "Coming together is a beginning. Staying together is progress. Working together is success." I'm so grateful and proud to have come together with you guys at Texas A&M University Corpus Christi, and I'd like to really particularly praise your leader, because it always starts at the top, Dr. Kelly Miller. There's no doubt together we are making progress and we are succeeding. So keep up the great work. I look forward to your presentation shortly, and let's keep moving through these stormy days as we are certain to enjoy the sunny days that lie ahead. I thank you very much and understand that we will be meeting now once a week, but make no mistake, our COVID-19 response is ongoing every single day. Just today, City Council helped approve dollars that will be significantly matched by county dollars in order to help us engage in a very robust public messaging campaign as we enter into the fall season. In addition, I'll let you know that the county is actively working on how we're going to bring safely the public back into the courthouse, thinking about important public and civic duties like elections and voting, and also coming back as a juror and participating in jury trials. All of these responses are being managed by the emergency management team, both at the city and the county, in cooperation with the health department. So while you may not see us but once a week here, rest assured, if you have any questions, don't hesitate. Reach out to our office. For the press, reach out to us directly. If we don't cover a topic that you are interested in, please let us know. And as always, don't forget, everything we do in healthcare depends on our federal dollars coming to us. So please make it count. Fill out the census at 2020census.gov. Thank you.
El día de hoy me da mucho orgullo estar aquí con los oficiales del ayuntamiento y poder darle buenas noticias. Ahora hemos ido de lo peor a lo mejor. En los últimos 7 días hemos reportado cifras bajas en cuanto a casos positivos. Ahora es el momento de tener más precauciones y evitar contagios, especialmente con la población vulnerable, ya que aún contamos con casos activos. Desafortunadamente, los fallecimientos se encuentran en 417 personas. Si usted está en el grupo de menor riesgo, aún así tome sus precauciones. He estado recibiendo información desde ayer, ya que el condado de San Patricio va a terminar con su orden, o posiblemente termine con su orden del uso de cubrebocas. Pero lo que dice la ley estatal es que, de acuerdo a los resultados de casos positivos, algunos condados pueden cesar esa orden cuando hay 20 casos o menos que sean activos. Así que nuestro condado aún no califica para cesar esa orden, aunque siempre existe la posibilidad de que lleguemos a ese punto. Quiero agradecer la contribución del equipo especial de Texas A&M, que nos han ayudado con su colaboración para poder entender y aprender de este virus. Me da mucho orgullo trabajar con el equipo de Dr. Bird, ya que hemos hecho gran progreso en cuanto a la entrega de información para nuestros residentes. El día de hoy también el Concilio de la Ciudad de Corpus Christi nos dio su aprobación para recibir fondos para solventar gastos por la pandemia. Continuamos trabajando también para poder regresar a la normalidad, aunque solo nos vea una vez a la semana. Ahora la directora del Distrito de Salud Pública, Annette Rodríguez, va a dar su presentación.
Thank you, Gabby. Annette Rodriguez, Health Director. So I am going to start today. City Manager Zanoni sends his apologies, was not able to make it today. So I'm going to start with the COVID-19 statistics. So if you look at the last 2 weeks, the numbers we're looking very well, very well. And again, I agree with the judge. Compliments to the community for everything that they are doing. So 37 was the high before today. The numbers actually went all the way down to single-digit numbers, which we're very excited about. And then today we saw 57. So I think some of that might be because of nursing homes. Now the caretakers are allowed to actually go and see their residents, but they do have to get tested. They have to have a negative test in their hand. So I think some of them may actually have gone in to get tested and found out that they were positive but asymptomatic. So we see a little increase in the numbers, and we'll watch it very carefully. Next slide, please. So this shows the total number of cases for Nueces County. We're at 20,472 cases since we started with our first case in March. And what you see is a normal bell curve. You see our height was probably around July 13th, 14th. You see yellow on top of the blue bar graph. Those are the state, what I call the state data dump, when the state sends us tests that were old, then we put them in the right days. And so you see the yellow tops on the blue bar graph. And then the numbers come way down, and then you see today's 57 there. Next slide, please. So on the donut graph, here you see that as of September 29th, we've had 19,725 out of the 20,000 recovered, 417 deaths, as the judge mentioned, and we have 392 active cases, which means people that are still sick in the community that could still potentially spread the virus to family members and to others. Next slide, please. And these are the hospitalization patients. So we see 85 2 weeks ago. Now we're at 70, which is really good news. So hopefully all of these have recovered and have been discharged. Next slide. And so we've been really, for the ICU, we've been staying kind of plateaued in the 30s. And finally, these last few days, we've seen actually in the 20s, which could be good news if the person's recovered and actually left. It could also mean that somebody has passed away, because we know that people in ICU many times have to be put on a ventilator. So, next slide, please. And so these are the number of deaths. We did have one death today, and my condolences do go to the family members of that individual that passed away. And so we're at 417 today. Next slide. And this is the final slide, and it basically shows the daily count in the blue bar graph, and then it shows the red line actually takes an average, and it shows a 7-day average, and we're at 21 now for a 7-day average, which is an improvement also. So for the health district, the health district drive-through is scheduled for tomorrow. So if you're still experiencing symptoms related to COVID-19, you can still call our hotline at 361-826-7200 to get registered. And also we do have our new Luminaire software system up. So you can actually go on the city or county website at www.cctexas.com/coronavirus, and you can click on the register for a drive-through link there, and you can register yourself. So that's very exciting for us. You can register for tomorrow, or if it's already closed, if we've already had it's full, you can register for next Wednesday on your own without having to call us. So I wanted to talk a little bit about MIS. Much is still unknown regarding the COVID-19. As we continue to analyze data, a correlation has been made regarding a serious condition that has been associated with COVID-19 infection. The condition is called multi-system inflammatory syndrome in children. This condition causes most of the body to become inflamed, including the heart, the lungs, the kidneys, the brain, the skin, the eyes, and the GI tract. Some of the symptoms include fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, and feeling tired. Currently, there are 29 cases of MIS-C, that's how it's abbreviated, multi-inflammatory syndrome in children, MIS-C, in Texas, and 14 more that are currently pending investigation, 4 of which were from our own children's hospital. The ages of the confirmed cases range from 9 months to 17 years old. Parents should seek immediate medical care if your child is showing any of the warning signs of MIS-C or other concerning signs such as trouble breathing, pain, pressure in the chest that does not go away, new confusion, inability to wake or stay awake, bluish lips or face, and severe abdominal pain, increased temperature, and vomiting. As more information surfaces regarding this novel virus, it is important that we continue to practice prevention tools. We have been assuming that the younger population is not affected as severely by the virus, but we are learning more and more that this virus could affect someone later in life. Therefore, it is important that you continue to practice the public health prevention tools by following the 3 W's. Wash your hands, watch your distance, and wear your mask. Due to possible exposure to COVID-19, our vital statistics at City Hall will be temporarily closed. You can still request birth and death certificates online, but there will be a delay as the vital records team will be placed in quarantine in an abundance of caution. Public Health is asking that you consider coming up with alternative ways of celebrating Halloween, and we will be talking about that more next week. Safeguard your children. Everyone 6 months of age and older should be vaccinated as we go into flu season at the end of this week. We will give more details on the do's and don'ts for Halloween. Our number one goal in public health is saving lives. So please stay healthy, stay protected, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 57 casos confirmados por el coronavirus, además de 5 casos provenientes del estado, casos anteriores cuyos resultados apenas fueron entregados el día de hoy. 19.725 pacientes se han recuperado por completo, 70 personas continúan en el hospital, 29 están en la unidad de cuidados intensivos, 392 son casos aún activos. Hoy se reporta un fallecimiento. A la fecha los fallecimientos totalizan 417 personas. La próxima toma de especímenes está programada para el día de mañana. Si usted cuenta con síntomas, se le pide llamar al 826-7200 para registrarse. También lo puede hacer a la dirección www.cctexas.com/coronavirus. Ahí se podrá registrar en línea. Aún se desconoce mucho sobre el COVID-19. A medida que continuamos analizando datos, se ha establecido una correlación con respecto a una afección grave que se asocia con la infección por COVID-19. La condición se llama síndrome inflamatorio multisistémico en niños, o MISC. Esta afección hace que la mayor parte del cuerpo se inflame, incluidos el corazón, los pulmones, los riñones, el cerebro, la piel, los ojos y los órganos gastrointestinales. Algunos de los síntomas incluyen fiebre, dolor abdominal, vómitos, diarrea, dolor de cuello, salpullido, ojos enrojecidos y cansancio. Actualmente hay 29 casos en Texas y 14 más que están pendientes de investigación. Las edades de los casos confirmados oscilan entre los 9 meses y los 17 años. Los padres deben buscar atención de emergencia de inmediato si su hijo muestra alguno de estos signos de advertencia de MISC u otros signos, como dificultad para respirar, dolor o presión en el pecho, confusión, incapacidad para despertarse, labios o cara azulados y dolor abdominal intenso. Es importante que continúe las medidas de salubridad. Lave sus manos seguido, cuide su distancia y utilice un cubrebocas. Debido a una posible exposición al COVID-19, los registros vitales en el ayuntamiento se cerrarán temporalmente. Aún así puede solicitar registros de nacimiento y de función en línea, pero se retrasarán ya que el equipo de registros vitales se pondrán en cuarentena. También le pedimos que si va a festejar el Día de Brujas, tome sus precauciones y evite así contagios. Ahora el Dr. Chris Bird nos va a dar su presentación.
Good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the task force. The task force has 2 objectives. The first is to address public concerns and questions about COVID-19 and the interventions or the rolling back of interventions that are taking place, and 2, to help enable evidence-based decision-making in the Coastal Bend area. We always review some of the interventions that are in place, but I promise you this is where this week's presentation will diverge from previous weeks. And we're going back to maybe a presentation like the first one that we gave back in March to tell you what might happen in the future. So you're encouraged to stay at home if you can, even right now where it seems like the sun's a little brighter today and everybody's got a little pep in their step because we don't have 400 new cases of COVID-19 today. And while we don't have a lot of new cases compared to where we've been, we have a lot of new cases compared to the last couple weeks of May before the summer outbreak occurred. You're encouraged to social distance and continue to wear face coverings. It's not a good idea to stop wearing face coverings if you want to be able to go to restaurants, if you want to be able to have your children go to school face-to-face. Face coverings are really the only way that this is going to happen. Self-isolate when symptomatic. Don't assume that you don't have COVID. If you're around somebody who tests positive for COVID, you should self-isolate until you get tested. There are school restrictions in place, but they're lightening up. We're going to more and more face-to-face schooling. The universities won't be doing that, at least this semester, but our K through 12 are going to more and more face-to-face. And we've gone through various stages of Open Texas. We've opened up to phase 3. We rolled back to 1.5. And I'd say after reviewing the rules more over the past week, I think we're back at Open Texas phase 3 or something thereabouts. I don't know if that's exactly what they're calling it, but that's what I'm gonna call it for the sake of the presentation. Okay, in the Coastal Bend area right now, our transmission rate is looking good. It's below 1. Remember, 1 is that line where the amount of COVID stays the same. If we go below 1, then COVID declines. So we're somewhere between 0.8 and 0.9, and what that means is if 10 people get COVID, they transmit that to 8 or 9 additional people. This heat map shows in the state of Texas where there is the highest probability of being below 1 for the transmission rate. The brighter the blue, the better. The more red, the worse. There's no red at all. White means kind of a 50-50 chance, and here there's a fairly good chance that we're below a transmission rate of 1 right now. So that's good news. Now, this has been happening for a while now. For 2 months, we've kind of had the same model parameters that we've been using because nothing has changed with the rules up until the last week. So in the last week, there's really been a huge change in the rules, and we really want to see what's going to happen. And so we're going to Open Texas phase 3 again. And the way this is working now is the governor's made an algorithm where if the amount of people in our hospitals is below 15% with the people with COVID, that for 7 days in a row, then we go to Open Texas phase 3. And presumably if we go above 15% of the people in the hospital being COVID positive for 7 days in a row, we go back to where we were over the summer with Open Texas phase 1.5. So what that means is that, and we've done this in the Coastal Bend since September 21st, we transitioned because we have been below 15% of the people in the hospital being COVID positive for the last 7 days. We've gone to 75% occupancy for gyms, for manufacturers, for offices, for restaurants, museums and libraries, and retailers. For other types of businesses, there haven't been any changes implemented yet. We're not sure if there's more changes coming, but right now, each one of these different categories has different sets of restrictions, so I don't want to try to even explain what it is. But there haven't been any changes in those other things like movies and amusement and water parks, performance halls, and things like that. So this is the change that's occurred, and when you open up more, you could affect the transmission rate. So this is a graph of the percent of people in our hospitals in the Coastal Bend that have been COVID positive from the beginning of the summer outbreak at the beginning of June to the peak in July and early August and back down to where we are today. This dashed line is the 15% line. So you can see we're just below it. And especially compared to where we were in early June, when on the task force, we were already concerned in the second week of June about exponential growth in the number of cases. You can see we're much lower than we are right now. And so if the transmission rate goes up, we're starting from a higher point. It can go up faster now than it did last time. So that's where we are now in terms of this decision line. When we go above that line for 7 days, then we shut down more in the Coastal Bend area. When we go below the line like we are now, we open up more. So this made me wonder, well, what's really going to happen under these new rules that are in place that we're following? Will this change the probability of us having an outbreak like we did over the summer? And so there's a lot of questions that we have. So with this relaxing of the restrictions, does this new hospitalization threshold scheme eliminate the chance of a large outbreak? I think that's a pretty good question to ask. 2, how many additional hospitalizations and fatalities could be expected in 2020, given these sets of rules that we've seen? And 3, how will we know if we're headed for another outbreak? Let me answer this one right now. We'll track with an exponential model the increase in cases if they do start to increase, just like we did at the beginning of June. When we start fitting the exponential model, we'll let everybody know. So for the other questions, we need to do some simulations to figure out the answers to those questions. So the simulations we're going to do are kind of like, remember the scenarios we did several months ago? We're going to do a couple scenarios. They're Open Texas Phase 3 scenarios. One is that despite going to Open Texas Phase 3, we see absolutely no change in the transmission rate, and we continue along the same trajectory that we've been on for the past couple months. And the other scenario is that we have an increased transmission rate where it goes to a value of 2. And there is little more decision that went into choosing 2. Other than that, it's halfway between where we were in June in terms of transmission rate and where we are now in terms of transmission rate. We were at 3.2. Now we're at 0.9, 0.8. So our transmission rate of 2 is intermediate between those two. And make no mistake, a transmission rate of 2 is pretty high. So there's some model assumptions that go into this. We're going to assume that as soon as this hospitalization threshold is triggered, we switch transmission rates. So on September 21st, we're going to assume that we went from a transmission rate of 0.9 to 2.0 immediately. And it didn't take a week or two for us to get there. But also, later on, if we start to increase, then we will turn off the transmission rate. We'll turn it down to 0.9 immediately if we go above 15% hospitalizations for 7 days in a row. That's the way it's going to work. There's other assumptions built into the model, but they're not that important right now. This is not a prediction of what's going to happen. It's a simulation of this is one of the possible things that could happen and showing you what's possible. Okay, so first, model 1, where there's no change. So the red data points are actual data points for number of people that are hospitalized per day with COVID in the Coastal Bend area. And you can see that the model fits those data points. The model is the green line with the green ribbon. It's fitting the data points pretty well, right up through the present day. The vertical lines with the dashes, they're showing the different Open Texas restrictions that were in place. On June 26th, that's when the first Open Texas Phase 3 ended, and we tried to start doing something about the outbreak that was occurring then. I'll point out that at that point in time, about 160 on this graph is 15% of the people in the hospitals having COVID. So we started to do something before 15% in June. It was actually about 10% of the people in our hospitals were COVID positive when we started to change the rules. Now the next week, by the time we went to Open Texas Phase 1.5, we were above 15%. So in that 1 week period, we went from below to above 15%. That wasn't being used then as a rule, but now it is. So from here forward, we're going to use that as a decision maker. So this other marker is Open Texas Phase 3. And if we continue on the same trajectory we're on, the number of people in the hospital will go down to almost nothing by the end of the year. And that would be a really great outcome. So that's scenario 1. And that's the null model. If you look at this, it took about 1 month in the past to get from we did something at the state level to we peaked. So from June 26th, it took 1 month before we peaked and then started flattening the curve. So remember that. Remember the assumption that I'm putting into this projection that as soon as we cross a threshold, we immediately change the transmission rate, but that's not actually what happens. So it's going to cut both ways. Sometimes it's going to be favorable for more cases. Sometimes it's going to be favorable for less cases, depending on the order that we go in. The other thing to notice is that it took 3 months. This is not a simulation. This is real. It took 3 months between when we started trying to control the first outbreak and when we got to Open Texas Phase 3 again. So we had 1 month of Open Texas Phase 3 and then 3 months of trying to get under control, and now we're going to Open Texas Phase 3 again. And the other thing I'll point out is in our model to control this green line, the way that we have it parameterized for the transmission rates, here in early June, we have it parameterized at a transmission rate of 3.2. That's for every 1 person that gets COVID. The model fits the data very well when that 1 person that got infected was transmitting to 3.2 additional people on average, which is a huge, huge number. It's essentially our estimate of absolutely no restriction in the transmission of COVID. And it took a couple weeks before we got down to a transmission rate of 0.9. And once we got there, it took another week and a half or so to peak and then start flattening the curve. So 2.5 weeks to reduce the transmission rate below 1 from when we started to try to do something is what actually happened before. So that's what we're learning from what happened in our scenario 1, where we go to 0. Now let's look at scenario 2, where as we open Texas again, we go to a higher transmission rate, which should not be an unexpected phenomenon associated with backing off on all the things we've been doing to try to decrease the transmission rate. So I'm keeping the transmission rates here on the top. So we're assuming in this model, now this is an assumption of the model, it's not a prediction, that we're just setting the model to go to a transmission rate of 2 and see what happens. By October 29th, we trigger the 15% of the hospitalized patients rule. And so it's after 7 days on October 29th, 15% of the people in the hospital in the coastal bend for 7 days have had COVID, and we trigger the closed Texas back down to 1.5, and the transmission rate goes to 0.9. That takes about 5 weeks from opening Texas phase 3, September 21st. Then we trigger it again as we come down, and we get that fall outbreak under control. By mid-December, we would open Texas again because the number of patients in the hospital would go below 15% for 7 days in a row. That's the rules that are in place right now in Texas. And then we would have the transmission rate increase to 2.0 again, and we get to December 31st. So that's what we project if the transmission rate does indeed go to 2.0 starting September 21st. And we can control the transmission rate like this by turning on and off open Texas, then this is what could happen. And this is the number of hospitalizations that we're projecting, but there's other things that are important also. Let's see, it takes 7 weeks to get under control, 5 weeks of open Texas phase 3, 7 weeks to get it under control before we open Texas again. So overall, we had 3 months of closure, that's real. We're projecting that if last week we went up to a higher transmission rate, we'll have 5 weeks of this open Texas phase 3 that we're in now before we transition into trying to get it under control for 7 weeks, assuming we can immediately turn it off. Everybody follows the rules as soon as the 15% threshold gets crossed. So what this means ultimately is that is a fall outbreak possible under these rules? It is possible. Now, will the transmission rate be 2? Well, not necessarily. It could be lower, and then there'd be less people that got sick, there'd be less people in the hospital, and it would go faster. It could be higher too, though, because we're not estimating the highest that we've ever seen the transmission rate go to. We're estimating halfway to the highest we've ever seen. So what are the other things that are coming out of this? So we saw hospitalizations. Clearly, there was a pretty big peak there in hospitalizations. That's possible under the current restrictions. Everybody out there was wondering, well, what about all the people that got COVID already? That's factored into the model. So we're not ignoring the people that already got COVID and can't get it again. We're assuming that if you got COVID once, you cannot get it twice in the model, and that's taken into account. So how many cases difference do we get between these two models from today to December 31st? We get 421 if we stay where we've been at a transmission rate of 0.9, and we would go to 12,387 cases if we end up in this scenario 2 with a transmission rate of 2.0. For the maximum number of people hospitalized on any one day, 73, which is essentially, starting today, it'll just keep getting lower and lower for scenario 1. And then scenario 2, it could go back up to 368 people in the hospital on one day that have COVID-19. And for the additional fatalities, we're looking at, if we stay the course we're on now, about 57 additional fatalities in the coastal bend by the end of the year. If we go to this scenario 2, we're looking at another 432 additional fatalities on top of the approximately 650 or so that have already occurred in the coastal bend. So one last time, we're not predicting that this is what's going to happen. This is what's going to happen if we go to a transmission rate of 2, if all the assumptions that I laid out come to pass. But several other scenarios are possible. Could be There could be more cases, there could be less cases, and that's where we come into play. So what are we going to do about this? We can change, we can affect how this future plays out. So it's a no-brainer. Relaxing measures designed to control the transmission rate is going to increase the transmission rate. There's no way around that. The only question is how much will it get increased? Will it be a tiny amount? We go to from 0.9 to 0.91, or do we go up to 2.5? The second one, seasonality, will increase the transmission rate. This is out of our control. We can't do anything about it. It's going to happen. As we go into the fall season, the transmission rate will increase. That's the reason why the flu season starts up again. And the transmissibility of the flu is much, much lower than COVID-19. And three, a vaccine could decrease the transmission rate. There are no vaccines that are available right now, at least maybe outside of Russia. There's no vaccines that we know work. And until that happens, we can't move forward assuming that we're going to have a vaccine. And once there is a vaccine, it's going to take a long time before we all get injected and get that vaccine. So what happens here, it's partially up to us. Our decisions matter. Do we wear masks? Do we not? Do we social distance? Do we not? I know that there's been a lot of discussion about herd immunity. What about herd immunity? Can't we just say forget it and let it go and just eventually we'll all be immune? Or, you know, aren't we there already? Aren't we close to herd immunity since we've already had this big outbreak? So let's talk about that. First, as more people become infected and presumably immune, and we're just going to leave that as an assumption of this model, if you will, the transmission rate will decline. If everybody is immune to COVID, the transmission rate will be 0. All right, so that's the way herd immunity works. But the way herd immunity also works is that you get COVID and you roll the dice on whether you're going to have severe lifelong health outcomes or not, or you know, even fatality. So we need about 70% of the coastal bend population to be infected to achieve herd immunity. And right now, our estimates are that between 7 and 20% of the coastal bend have been infected. So we still have a long ways to go to get to 70%. We also know that there's been about 640 people that have died in the coastal bend from COVID-19 up to at least the state's counting yesterday. And so we can use these numbers to calculate how many more people would have to die for us to achieve herd immunity in the coastal bend. And that number comes out to 1,598 to 5,751 more people on top of the number of people that have already died in the coastal bend area would have to die for us to achieve herd immunity without a vaccine or without any other mechanism of achieving immunity in the coastal bend. And so I, at least personally, as a voter and a citizen, find this number distasteful and one that I find worth the sacrifice, the minor sacrifice of wearing a mask. It's not that big of a deal, staying 6 feet away from other people. That's what we're trying to avoid here, is getting all the way through this. Now, the question is, are we just going to get there slowly and have all these people die over a prolonged period of time? Or are we going to try to really stop that from happening and make it till we get to a vaccine where then people can be vaccinated and we don't have to see these levels of fatality? So in the end, in summary, given the new Texas 15% COVID hospitalization threshold, a fall outbreak is most certainly possible. Whether it happens is up to us. If we stop wearing masks, if we stop social distancing, if we just go back to the way things used to be, get ready for another outbreak. The transmission rate right now, it's between 0.8 and 0.9. That's our best estimate. That's very favorable. But I want everybody to remember that we're always a couple weeks behind COVID-19. And these models that we use to estimate these transmission rates, one is based on fatalities, where we're a month behind usually on fatalities. And the other is based on cases where a couple weeks and hospitalizations where we might be even 3 weeks behind. And so this is our best estimate today, but it's not the estimate of today. The estimate of today we won't get for a couple weeks. If we can hold steady at this rate, which we've been at for about 2 months now, then COVID-19 will continue to decline, and you saw the scenario play out for that, the green scenario. If we relax the guidelines, which we're doing, and seasonality and these things, it results in a substantial increase in the transmission rate, we can expect another outbreak to occur. And that's what we want to try to avoid. So wearing a mask now is even more important than it has been, because now we're trying to stop another one of these outbreaks from occurring. We just got the last one under control. That doesn't mean that, oh, it's okay now to take your mask off, right? We're humans. We're supposed to be smarter than other animals in the animal kingdom. We're supposed to be able to learn from our experiences. We tried to go back to normal in May. By July, there was a lot of people that were sick, and now over 638 people, actually 634 more people have died since that period when this took off in May in the coastal bend. And so that's what we want to try to avoid, another batch of several hundred people dying again, another batch of thousands of people going to the hospital. And I'll end with, I got an email right before I presented here from a doctor at one of our local hospitals. He said that we still have FEMA nurses in our hospitals helping because our ICUs are still stretched. I'm not presenting on our general results today. If you saw my presentation last week, everything from last week holds for today. We're slowly declining, but the ICU is still stretched. People are still working extra shifts. People are still working extra hours in the hospitals. So they haven't gotten over this last outbreak yet. And if they haven't, I think that we should have the common courtesy to our frontline workers to try to help them out and maybe get down to a level where they could not work overtime on a regular basis. And definitely not put us back in a situation where we really start to need those FEMA nurses and more than we already have. So with that, we'll go to the translation, and we'll take some questions from Facebook.
Le seguimos pidiendo que tome todas las medidas de salubridad para evitar los contagios. No es buena idea aún dejar de usar el cubrebocas. El radio de transmisión ahora se encuentra entre el 0.8 al 0.9, lo que significa que una persona infectada tiene entre el 80 al 90% de posibilidad de contagiar a otros. En los últimos 2 meses no ha habido mucho cambio hasta la semana pasada, cuando el gobernador cambió las reglas y los negocios pudieron atender al 75% de su capacidad. Esta apertura puede cambiar los resultados por el radio de transmisión, el cual tiene la potencialidad de aumentar. Ahora que hay nuevas reglas, también hay más preguntas, como si habrán más hospitalizaciones o cuántas muertes habrán antes de que termine el 2020, o cómo sabremos si habrá otro brote por el virus. Asumiendo que el radio de transmisión aumente del 0.9 al 2, esto significaría un aumento significativo de casos adicionales, hospitalizaciones y fallecimientos. Lo que suceda en la realidad va a depender de nosotros, basado en las medidas de prevención que usted tome. Las estaciones climáticas pueden cambiar el radio de transmisión y una posible vacuna podrá reducir el radio de transmisión. En cuanto a la inmunidad en el área de la costa, entre más personas se infecten y se vuelvan inmunes, el radio de transmisión va a disminuir. Si hay un 70% de personas infectadas, habrá mayor inmunidad. Las cifras actuales estiman de un 7 al 20% de personas infectadas. Para lograr una inmunidad, tendrá que existir de 1.598 a 5.751 personas fallecidas en el área de la costa. Actualmente, las personas fallecidas en el área de la costa se encuentran en 634 personas.
Dr. Edwards.
There's a question about one of the slides where you got the statistics of where are you getting the 7 to 20% infected so far in your
Great question. So one of the models that we run is from the Imperial College in London. We've adapted it to Texas, and that model makes an estimate of how many people have been infected. So that number, it's not based solely on how many people have tested positive. We're estimating how many people actually got infected, given that not everybody gets a test when they get COVID-19. And so that model makes an estimate of about 7%. The other model that we're running has an estimate of about there's a 5.6x more people that are infected than test positive. And so between those two models, that's where we come out with the estimate of how many people in the coastal bend have been infected. They project between 7 and 20%. There was a recent scientific study that estimated, I believe it came out last week, that 10% of the people in the United States have been infected with COVID-19. So our estimates fall right within that average for the US. And given that we kind of got it worse than a lot of the rest of the US over the summer, it makes sense we might be above that 10% number as opposed to below.
Next question is probably an Annette question. Can adults get multi-symptom inflammatory syndrome?
That's a great question. The answer is I have never seen MIS or multi-system inflammatory syndrome in adults. I have only ever seen it referred to as in children and sometimes referred to as Kawasaki disease. So the answer is no.
Okay. And this is kind of a continuation of that same question. They've heard 29, 57, 67, and the numbers for the new strain is a part of that. The numbers that were reported earlier for the MISC?
Can you repeat the question?
On the new strain of MISC, they've heard the numbers 29, 57, and 67. Are the numbers for the COVID test positive are part of those numbers there?
Okay, so we only have 4. The 29 were in the state of Texas, all across the state of Texas. Actually, the 29 did not include any in Region 11, which we are in Region 11. There are an additional 14 in Texas that are being investigated by the Department of State Health Services at this time, and 4 of those are from the coastal bend. One of them is specifically from Nueces County.
Okay. Since we know undetected cases play a major role in transmitting the virus and most cases are not reported, how many people in Nueces County do you think will really recover yet were never counted?
Recovered, but were never counted.
There have been 638 or so fatalities in the coastal bend. If you take the 22,000 or so confirmed positive and then factor that up by the 5 to 10 times. So
100,000.
better if I had done this beforehand, but give me a second. So if you go with the 5X thing, then you're looking at 100,000 people in the coastal bend that have been infected, and only 638 of them have died. You divide 638 by 100,000 and multiply by 100. That's your fatality rate, your estimated infection fatality rate. And then the op1 minus that is going to be the proportion of people that don't die. That would only include people where COVID was the primary cause of death and not a contributing cause of death.
Sure.
All right. Thank you, and that's all from Facebook.
Thank you. Are there any other questions?
Yeah, so that's 0.6% and 99.4% on those numbers. So about 99.4% of people that's one estimate, survive, and 0.6% die.
Is the drop in cases in Nueces County a good sign for the county?
Absolutely. So, but we know that nationally the cases have also been decreasing. So we're all looking to see, Europe is also experiencing a spike now. And so as the weather, the seasonality, the weather changes, we know that we are expecting additional flu cases, especially if people do not get their flu vaccine. So we worry about co-infection with flu and COVID-19. Thank you all, and we will see y'all next Tuesday. Appreciate you being here. Thank you.